This is Chapter 4, Communications and Documentation, and I think you'll see at the end of this why we put it behind patient assessment. When we communicate verbally as well as written, which is our documentation, and I think you'll see that it makes a lot of sense here. So recording the patient findings through documentation, there's a little saying that goes, if you didn't write it down, you didn't do it. So you may have taken 3 sets of vital signs, serial vital signs, looking at that patient's trend in that ongoing assessment or the reassessment, but if you don't write it down, nobody gets that information. You communicate all the time. You communicate, maybe you need to call for more resources, transfer care of the patient, and interact with that whole team structure. We also do something called therapeutic communication, and it's conveying a message to your patients that lets them know that right now you're the most important person in the world in front of me. I'm not distracted by the last call. I'm not, thinking about what time I get off or, my shift is over. I'm thinking about, taking care of that patient's needs. So we're going to talk about some interviewing techniques to really help out with this. As far as medical terminology at the EMR level, it's going to be very basic. The biggest thing is to be able to communicate with all members of the team in a way that everybody understands. So just like the patient that I gave as an example in patient assessment and said he was having chest pain, I wouldn't go to him and say, well, sir, it looks like you're having a myocardial infarction. He may not understand that, but he understands heart attack, and I'm concerned about you. That makes a better impression. So communication is an important part during every phase of the call. That information from the dispatcher, making sure they get accurate information and send you to the right location and send the right responders to that call, as well as telling you what that information is. That you need to communicate with all parties when you arrive on scene, including other public safety members who may show up on scene. And after the call, you have to document that condition of the patient and the treatment given. These are legal documents. They're going to be part of the patient's chart forever. And you never know, 2 or 3 years, that somebody may need information off of a call, and you want to make sure that your documentation was complete. So we're going to talk about some of the communication that we're going to use when we cannot communicate face-to-face, and it's divided into 2 categories: voice communication and communication that transmits data. So voice communication is spoken word from one location to another. It's regulated by the Federal Communications Commission, FCC, who assigns your service a frequency so that there are no other frequencies near that, so we don't have bleed over of information. The radios that you're going to use at the dispatch, you'll have a base station that usually has a higher wattage, maybe 100 watts, so it can transmit information over the longest distance. Your mobile radios are attached inside of a vehicle. That's why they're called mobile. Portable radios are low wattage, maybe only 1 to 5 watts, and they're also called handhelds. So those are your portable radios. Since portable radios are really for short range, you may have to use a repeater, and that's usually at a fixed location at a very tall site that can take that information and repeat it at a higher output to reach further than would be just on its own. Telephone systems are still voice communication, so it could be a landline that is hardwired in the home or the business, or a cell phone that relies on radio waves as well as service from a cell tower to send and receive phone messages. Data can be transmitted through either a radio system or a pager system, and also internet system. So paging systems, not too many people use these anymore, maybe for response, and that's about it. Mobile data terminals then will transport data messages through a radio system. Fax lines, telemetry at the advanced level, email, these are all data systems for modes of communication. So functions of radio communication. First off, their dispatch receives the information typically from voice, from a cell phone or a landline. Soon they'll be able to start accessing this from text messaging, which is the next phase in dispatch. It's your duty to keep your equipment on and serviced, charged, batteries, everything while you're on call or on duty. And if you're unsure about information that you receive, always ask, whether it be dispatch or whoever, to repeat it. Get clarification on that. When you're responding to the scene, before you leave the station, understand where you're going. These are where your map books or your GPS or just knowledge of the area really comes in handy. The dispatcher may give you further information while you're en route to the scene. You know, you're going to go down this road and you turn left here, so many miles, turn left here, and give you guidance all the way there. So if there's any delay for whatever reason, notify dispatch, because they kind of have an expectation that you should be there in an estimated time of arrival or an ETA of this much time. When you arrive at scene, do that scene size up, again for your own protection. If there's any information that you can convey not only to dispatch but to other responders of that, you know, let them know, hey, this road's flooded, go another way. Then that saves them some time. They don't have to see the same thing that you did. Number of patients, additional assistance is, you know, something that you want to convey to them very early on, rather than 5 or 10 or 20 minutes into that call. Update EMS responding units. You know, let them know what you have. Hey, I've made patient contact, and patient seems to be doing okay right now. Then they can kind of, okay, you know, we're on our way, but at least we know somebody's there and the condition of the patient. When we transfer that care to other EMS personnel, be prepared to hand off not only a verbal report but a written report. So you want to use that same approach that you did in a patient assessment. Age and gender, something about the history of the incident, something about their chief complaint, level of responsiveness, how you found the patient initially, any kind of information that you can give about vital signs, airway, breathing, circulation, anything normal, abnormal you found on the physical exam. The sample history, that's a great amount of information. If you can already have that done in that handoff communication, that saves them a lot of time, as well as any intervention that you did prior to their arrival. If need be, if you need to do something where you need to contact medical control because it's not in your protocols, then that's what you do. You contact receiving hospital, your medical director, and say, hey, this is what I need to do. It's within my skill. We just don't have a protocol for it. But EMRs will not get permission to do anything outside their scope of practice. So it's not like, well, I want to start an IV. Let me contact the doctor and see if he'll let me. It doesn't work that way. After the run is all the way over, then you report your status to communication. Dispatch, I'm in service, you know, clear of scene, or whatever. And then you want to let them know that you're available for another call and think about doing that run report. So these are the functions of radio communication. This is in your book on table 4-1, and it's just kind of neat information. So monitor the channel before transmitting. Just listen and make sure you're not walking over anybody else, because these are all simplex, push to talk. Only one person talks at a time. Plan your message. Think about what you're going to say before you push the push to talk button. Hold the microphone 2 to 3 seconds from your mouth and wait a second before starting your message. If you have a repeater, it's going to take that long to hit that repeater. We usually want to say, you know, unit whatever to dispatch, or dispatch this is. Use plain language, plain English. Keep it very brief. You know, you don't have to say 10-4 or anything. Just make sure that whatever you do say is very clear to the receiver. As far as good communication, we talk about getting feedback to make sure that they understand what you meant. You can talk and talk and talk, but if they don't understand what you meant, it's not communication. So we want to make sure that it's received and understood. We want to keep external distractions, noise, and other people talking down to a minimum. Again, you control the scene. When you walk into that house and the TV's on or somebody's yelling, you know, you get everybody out of the room, you turn off the TV, and then you can avoid all that. Internal distractions sometimes is letting you think about, oh man, I need to get back. I was going to make a phone call, the bank's going to close. Those are things that sometimes happen, and you have to think about, this is the most important person in my life right now is this patient. Tomorrow the bank will be open then, or whatever it is. As far as effective communication with patient, this is our therapeutic communication. I want to keep this short, so I'm going to go ahead and stop it here, and then we can continue with part 2 after this one.